So good evening. Welcome to tonight's JCU Health Professional CPD webinar. My name is Clara Joe, and I will be coordinating JCU Dentistry CPD sessions this year. Before we begin, we'd like to acknowledge the Australian Aboriginal and Torres Strait Islander peoples as the first inhabitants of this country and pay our respects to the traditional owners and elders, past, present, and emerging, of the land on which we stand today. It is my pleasure to introduce you to Associate Professor Louise Young, who will be providing teaching tips for time-poor clinical supervisors this evening. Professor Young has over 35 years of experience in education, and she is currently an Associate Professor in Rural Medical Education within the College of Medicine and Dentistry at JCU. This role encompasses postgraduate education coordination for a suite of health professional education courses and preceptor support for developing teaching skills among clinicians. Therefore, we're very grateful to have Professor Young deliver this presentation tonight. Just a few housekeeping items. As you can see on the slide, there are CPD certificate eligibility requirements there, and these requirements are for dentists who have registered to attend this session. CPD certificates will be made available to dentists, while participation certificates will be made available to all attendees from other disciplines. This is due to the accreditation requirements of other disciplines when it comes to the provision of CPD. So for other disciplines, we will be providing participation certificates. If you have questions, please submit them using the question box below, as some of you have already done to respond to our question. Louise is happy to pause at different intervals to answer your questions, and I will endeavor to raise them at appropriate times as well. The last few minutes of this webinar will also be reserved for questions and answers. So without further ado, I'll now hand over to Louise. Thank you, Louise.
Thank you, Clara. I'm delighted to be speaking with you this evening, and I hope by the end of this session that you'll have a few tips to take away to use when you're supervising students in clinical practice. So we're very much focusing on teaching tips for time-poor clinical supervisors. Very often we think we haven't got time to teach, but I hope the four different approaches I'm going to talk about today will sort of convince you that even if you've only got a minute, you have time to do something in terms of teaching, and that your students will perceive as teaching. I'm going to be using examples both from dentistry and medicine. However, the skills that I'm talking about are generic. So they're not specific to a particular discipline or profession. All right, so my learning outcomes. If you set some learning outcomes before you begin any session, it makes sure that you actually accomplish what you want to accomplish. So today we're going to have a look at the 1 minute preceptor. We're going to have a look at how to ask high and low cognitive level questions. We're going to describe the principles of giving effective performance feedback. And finally, we're going to discuss the impact of failing to fail a poorly performing student. So let's get started. The first thing we're going to have a look at is an approach that's called the 1 minute preceptor. Now, this is an approach that is really easy to remember, and each step is designed to take less than a minute. So it's really that sort of between patients discussion or walking down the corridor between, one ward and the next, that sort of thing. So the 1 minute preceptor, the advantage of it, it's actually a really nice, neat little package of teaching. It evaluates the learner's performance. It delivers effective clinical teaching, but focused clinical teaching. It's timely. It provides necessary feedback. It provides learners with meaningful participation. And above all, research has clearly shown that learners like this sort of teaching. So even though it's a short amount of time, the learners get something out of it in knowledge, assessment and feedback. So that's what makes it a really neat little package. And the research evidence has shown that compared with long teaching, this is just as effective in terms of student learning. All right, so there are 5 micro skills involved in the 1 minute preceptor. First of all is get a commitment. So you say to the student, what do you think is causing the pain, or what is the provisional diagnosis? Just a general question to elicit a response. You need them to say you know, something. If they say something that's correct, that's great, you keep going. If they say something that's incorrect, it at least gives you an idea of where to start. Microskill 2 is probe for supporting evidence. So you've asked the question about what do you think is going on? So what led you to that conclusion? How do you know? Again, the student is doing all of the talking. You've just posed the questions. So they give you a little more information. Based on what they tell you, you then teach them between 1 and 3 general rules or pieces of information. That's all. It's got to be focused. And the 1 to 3 general rules, you know, about a minute's worth. Remember, we're trying to complete all of this in under 5 minutes. So what are the important things that the students need to know at this point of their training? Microskill 4, provide positive reinforcement. It was really great the way you identified that the patient was afraid or the patient had a fever. And then Microskill 5, correct any mistakes. Now, this is a really easy approach to remember and to be able to go through with it with a student in a short amount of time. So the advantage is it's time efficient. It takes about 1 to 5 minutes. It's very much learner-centred or student-centred, and that's what students like. It integrates learner assessment into each encounter, promotes evaluation and feedback that is timely and specific, and as I said before, it's got research validation that this is really an effective way of teaching. Another model is the 5-minute preceptor. Again, I'm just showing you it's got the same sort of approach. So the 1-minute preceptor, 5-minute preceptor, 5 steps. So asking a question, getting some more information, teaching 1 to 3 pieces of information, reinforcing what was done correctly or said correctly, and correcting any errors or misinterpretations. All right, so you're thinking, all right, I've got to teach between 1 and 3 pieces of information. What do I teach? Now, for any patient case, any of the areas listed on this slide, you might cover, could quite easily be covered. However, between 1 and 3 pieces of information. So how do you decide what is it that you're going to teach? 3 words I use a lot are essential, useful, and bonus. So you're going to teach them the essential pieces of information they need for this patient case, but related to the stage of learning. So if it's very early on and it's a clinical placement, something really basic and concrete. Say you're doing diabetes, for example, you know, a core piece of information that they need to know, not everything they need to know about diabetes. They're not going to remember it if you give them a great long list of things that they need to know about a particular condition. So keep it focused and keep it between 1 and 3 facts. You cover the essential, generally is all you would do in the 1-minute preceptor, between 1 and 3 essential facts or pieces of information related to the case. All right, so deciding what to teach, you look at the all of the different areas and pick 2 or 3 essential. You might then say you might only have 1 essential piece of information, something else that's useful. Generally, for a teaching situation, you wouldn't get to the bonus level. So what we're doing in the teaching is breaking it into steps and little manageable portions that we can do with the students. So in the summary of the 1-minute preceptor, get a commitment. So what do you think's going on with this patient? Probe, how do you know? Why do you think that? Teach 1 to 3 general rules, reinforce what was correct, and correct any mistakes. So in these 5 steps, you're asking a question, you're having the student elaborate with further information, but you're also teaching them 1 to 3 pieces of information. You're giving them feedback by reinforcing what was correct, and you're also assessing them by correcting mistakes. And above all, students love it and they perceive that you are doing great teaching, even though it's in a short amount of time. The research has shown that students see it as a really effective way of teaching because it's learner-centred. They are receiving, you know, all of the attention. They're doing the work. Sometimes as teachers we think, oh, if I'm not doing the talking, I'm not teaching. However, it's far better for student learning if the students are able to actually be doing all of the talking. So that's the 1 minute preceptor. That's our first teaching tip for tonight. Has anyone got any questions on the 1 minute preceptor?
No questions have been posted yet.
Okay, that's fine. Look, because this is a webinar, we don't have an opportunity to practice, but next time you have a student, have a go at doing it. All right, the second skill I'd like to talk about is effective questioning. Now, I think if you can ask a good question, if you've got a particular approach for asking questions, that actually can be the basis of all your teaching. I think very often we think that questions are something we do at the end. We might do them at the beginning to find out what the students know and then go from there. But I'm going to show you how you can use questions as your entire teaching approach. Again, questions can be asked in a short amount of time. So it's not something that takes up a lot of your time in terms of being in the clinic. So good questioning skills are a really important teaching technique, I think. So if you look at these figures, the figure on the right, the problem-solving figure, when we ask a question, we give them a problem, you know, pose a situation, and we want a solution, we want an answer. Now, in a clinical situation, yes, that's possibly what you are wanting. However, if you're wanting to make your teaching, a question the focus of your teaching, you're better off doing the figure on the left-hand side. Because what you're trying to do is create a conversation with the student. Because the more that the student is talking and sort of you're pushing their boundaries and testing them, the more they're learning. So if you've got a problem, keep asking questions related to, so, you know, what do you think is going on? What might the diagnosis be? How might you manage it, treat it? And any basic sciences questions related to anatomy, physiology, biochemistry, that sort of thing. So you just keep asking questions related to that, building up the information about a case. You then get them to refine all of the information they've got, you know, come up with what they think the solution and the treatment approach is, and then they tell you what they're going to do. Now, they're the steps of clinical reasoning. So just through a series of questions, you've been able to step them through the basis of learning how to do clinical reasoning. And this is what we're wanting students to be able to do as, you know, they begin to practice as clinicians. We want them to do this process automatically. So by you role modelling it, but they're still doing all of the work. So, all right, you might be thinking, well, what do I do? You know, how do I keep this going? What sort of questions do I ask? The purpose of questions might be to direct attention, to motivate, help the students reflect on some information that they've been given. It might be to revise something they've done previously. It's also useful for you to diagnose their strengths and weaknesses. So if you've got a student that you've not had before, you don't know what they know or what they've done in the area, a question that sort of tests them, I guess, you know, tries to get some information out of them. If they're able to do it, well, it gives you actually some idea of their strengths and weaknesses. A question also can be to review or summarise. And another way, I think a really good approach for asking questions is for you, it's feedback for you as the supervisor. It'll help you gauge the effectiveness of your teaching or supervision. So if you think you've taught them something and that they should know it, and if you ask them a question, well, hopefully they will know it and you can move on. But if they don't know it, that sort of says, well, there's a problem here. We need to step back and take another look at it. All right, so when you pose questions, how do you do it? Think about the phrasing. Keep the question brief, clear, and simple. You might be asking a question about a complex physiological process, but it doesn't mean the question has to be complex. If the question is too complex, the student will spend all of the time trying to work out what it is you're asking and not actually get to providing the answer. So they're silent, you think they don't know what the answer is, and you fill it in by giving them the answer. If a question is brief and clear and simple, it encourages the student to at least say something. If they say something, it gives you something to work with. They might say something and it's correct, so that's great. You can go on with another question or provide some information. If it's incorrect, it tells you need to go back. You need to think about the structure of your questions, and it's really handy when someone is a learner to give them some background information or include some prior knowledge. So you might say, remember the patient we saw last week who had, all of her molars were missing. Now, it's immediately helping the student to go to the section of the brain where that information is stored, rather than just asking them a straight question about, so what's the cause of, molars falling out, for example. The next thing you need to do, and this is when you're using questions as a learning opportunity for the student, keep them focused on a single task. Just ask one thing with one question. Don't do double-barreled questions. For example, what anatomy is involved in the respiratory system, why, and why is this important? It's too much processing for the student. When you're a learner, there's a limit to how much you can process, what we call the cognitive load. There's a limit to how much you can take on board and you can talk about. So again, the whole point of asking a question for a learning opportunity is to get an answer so you've got something to work with. Also with questions, you need to include wait time. And if you've asked a question, and this is if you've got more than one student with you, it's suggested that you redirect the question. So either re-ask a different question if they can't answer it, or ask someone else. The whole point of asking questions is for the students to be the active learners, for the students to do the talking and the thinking and the working out. They see this as good teaching. I think sometimes as teachers, we think we need to be talking all the time. But from a student perspective, if you're making them do the talking, they think you are doing a great job at teaching because they're learning, because they're talking. Now, we talked about wait time. Wait time. Why do you need to have wait time when you ask a question? How long should you have wait time for? Jot down how long you think wait time should be. That was 5 seconds. As I've been teaching more years than I care to think about, and that dead air makes me nervous. I left a gap there. It was actually a little more than 5 seconds. When you're doing it with students, try and give them at least 5 seconds after you've asked the question to come up with the answer. Don't expect an instantaneous response. And by waiting, the students will think that, okay, I need to say something. And I've not had students not give an answer or say something within that 5 seconds. So it's just something that works. And remember, we're trying to create a teaching opportunity or a learning opportunity for the students. If you're doing the talking, it's not as beneficial for their learning as if they're doing the talking. So wait time so that they they do say something. Even if it's wrong, it gives you something to work with. Whereas if they say nothing and you give them the answer, it throws the, I guess, the work back onto you again, because you've now got to think of another question to ask them. So think about how you can more effectively use questions as a teaching opportunity to help you in terms of your time commitment to teaching. Now, we've got a couple of types of questions. We've got low order questions and higher order questions. So the low order questions are ones that start with what, when, where, list, that sort of thing. Generally, it's for subject matter and facts. It often only requires rote memory or very superficial learning. And generally, it's a single word response. So you might say to the student, are you going to treat them with this drug or with this drug? The student's got a 50% chance of getting the answer. They just pick one or the other. If they pick the correct one, you think, terrific, they know the answer. If they don't pick the correct one, you think, right, they don't know it, need to do some work. But the student who said the correct answer may not have known, it was just a lucky guess on their behalf. So low order questions aren't particularly useful for learning. They're handy at the very beginning when you want to perhaps gauge what a student knows when you're meeting them or working with them for the first time. However, from a learning point of view, higher order questions are a much better way of doing it. And higher order questions start with stems such as how, why, tell me about, tell me how. Again, those sort of questions are inviting the students to say anything. So can you tell me about the anatomy of the head? Right? You're not asking a specific question, so the student is encouraged to say anything that they know about the anatomy of the head. Clara, you got a question?
There's just a question about wait time. Wait time affected by the ethnic background of the student, would you say?
Is it affected?
Yes.
No, all students.
All students.
It's a general principle, yes. Perhaps someone, perhaps where English is not the first language or the dominant language, you might even give them a bit longer, but 5 seconds is the minimum. And as you could see with me counting it, you know, with that gap, it's quite a long time. So yes, and students are very strategic. If you ask a question and don't give them long enough to answer and jump in and tell them the answer, they'll then think, oh, I don't have to try and work out an answer, because if I just, you know, play I'm quiet, I'll be told the answer. But that's not really useful or beneficial for learning. So is that the only question?
Yes, that's the only question.
Okay,
Thank you very
I
much.
hope that's answered your question. The higher order questions also, it helps the students to develop thinking and reasoning skills, because you can't answer a higher order question usually with a one-word answer. You can't answer it yes or no, or, you know, pick one medication and not another. It actually involves putting together more than one piece of information in order to come up with the answer. So that's why higher order questions are beneficial for learning. One of the one of the models that we sometimes use to when we're asking questions is a technique or an approach that was developed by Benjamin Bloom, and it's called Bloom's taxonomy. Now, he's got 6 levels, going from low cognitive, which is the knowledge level, up to high cognitive, which is at the evaluation level. Now, if you look at the words listed next to each category, down at knowledge, what, when, where, list, name, it could be memory that allows you to answer that question. So comprehension, describe, summarise, discuss. You need a bit more information in order to answer the question. Application, and then analysis, you're having to explain, connect, compare, infer, synthesis, combine, create, rearrange. More complex cognitive skills that you're needing to use to answer the question. And then evaluation, assess, decide, discriminate, summarise. I think the evaluation level very much incorporates coming up with a diagnosis and management plan for a patient. If you're asking questions that are all what, when, list, name this nerve, name this body system, that's low cognitive level. It's not as beneficial for learning. However, if you're asking questions at the analysis, synthesis, and evaluation levels, you're actually sort of making students step up a notch and making them think. So they're actually having to do the work. So when you're asking questions, think about how can you get away from the what, when type of questions, the basic facts where there can be an element of guessing and they get it right, to questions that involve analysis, synthesis and evaluation, so that they're actually having to learn to think and to process information in order to answer your question. All right, if you teach or if you often have students that you're working with and they're in pairs, you can ask different types of questions. So you've got the open and the closed questions, just like when you're asking, you know, patients, taking a history from a patient, you'll ask a range of open and closed questions. However, some other question types are the reverse or boomerang. And this question type is the student asks you a question. So what's the diagnosis for this patient? And you reverse it or boomerang it back to the student. That was a really good question. What do you think is the diagnosis? So you're actually making the student do the work coming up with the answer. A relay question is if you need 2 students at least for this. You ask the question and you might get part of the answer, but it's not enough. So you go to the next student and say, can you add a little bit more? And then if you've got more than 2 students, the next student, can you add a bit more to this? So one student may not be able to answer all of the question, but by using the relay method, you actually get all of the information out that you want to be able to continue on or work with the patient. So think about the questions that you are using, and it's being rather strategic because you're actually you ask the question, but you're making the students do the work. And when the students have to come up with the answer, they're actually learning something, and they do attribute you to being a good teacher because they're learning something. However, if it's just straight low-level questions where they're just rote answering, it's not necessarily a learning opportunity for them. We also suggest that you avoid rhetorical and leading questions when you're in the supervisory role. If you might say to the students, well, you've all covered this in year 1, so we'll go on. And one student could be in the group and they could be thinking, gee, I don't remember that from year 1. But by saying, well, we all remember this, don't we? They're not going to be brave enough usually to put their hand up and say, no, I really don't remember that. Would you mind, could you go over it? So think about how you ask the questions, because sometimes if you do say things like, now everyone knows the answer to this, don't they? If the student doesn't, they're not likely to identify that they don't understand and you've missed a learning opportunity. With answers, if you've got at least 2 students, correct responses, you could say, good, yes, that was right. But a better response that you can give for a correct response is to say, that was correct because you identified the patient's social history as being important in this case. So you're actually teaching them back a bit. They might have just said something and it was a complete guess, but by you emphasising what it is that was important, it's a learning opportunity for them. Again, for a partially correct response, identify what was correct, but then you can also add a little bit more about what else was required for the answer. For an incorrect response, you perhaps try someone else. Remember, you try not to answer. You're trying to get them to come up with the answers in order to make it a learning opportunity. So for an incorrect response, don't just say no. Try rephrasing the question. Try asking someone else so that you do end up coming up with an answer to that question. And for no response, so the student is just standing there and not saying anything, you ask another student or you ask a different question. If you ask a question and then answer your own question, students very quickly get pick that up and think, beauty, I'll just, keep quiet and I'll be told the answer. But that's not really good for their learning. So it's much better if they say something and you can work with it. Even if it's incorrect, you've got something you can work with and it can become a learning opportunity. Okay, so that's all I wanted to cover on effective questioning. Any questions? Okay, I'll move
at the
on.
moment.
Sorry?
No questions at the moment.
Questions. Okay, thank you. All right, the next section is on giving feedback. One of the rules that you really do need to get, or one of the things that those of us who've been teaching for a while is to actually say to a student, okay, stop, listen, I'm going to give you some feedback. Don't couch it in terms such as, I want to have a chat with you, or how do you think you're going, that sort of thing. If you're going to give them feedback about their performance, tell them they're getting some feedback. I was once caught, I thought I had some first year medical students and I thought I don't want to intimidate them or make them, feel concerned, because it was a feedback session. And I just said, I'd like to have a bit of a chat with you and see how you're going. At the end of the semester, each of the students in that group said they hadn't received any feedback. So be quite direct and say, you're getting some feedback, you need to pay attention to what you're going to be told. So here's a table on effective feedback and feedback that you should avoid. So effective feedback should describe what it is you're wanting the student to do or not to do. It needs to be objective, specific, balanced, both positive and negative. If you are giving feedback and it's something that's quite sensitive, or the student is likely to be embarrassed, try and do it in private. So you might have to delay it, so it's not done straight in front of the patient. If it's something that's really big, like a patient safety issue or something major that the student has done incorrectly, you might need to schedule it for a time at the end of the clinic or whatever. Again, think about how much time you've got and how many things, how many topics you're going to cover. The student might have mucked up every single thing, but think about the essential useful bonus. Pick what was the worst thing that the student did and cover that. If you give too many topics, tell them too many things that they did incorrectly, after about the second or third, they're going to zone out and not take any notice, not stop listening anyway. So it's always a good idea to just limit it. Pick, what's the one thing you really think the student needs to improve. Clara.
There's just a question asking if there's a specific example that you might be able to provide.
For
the feedback, I suppose, as in
on the major issues.
Yes.
If a student said something totally inappropriate to a patient, if they If it was a major, often it's professional behaviour type issues, aspects related to professionalism, because you don't want them doing it in front of the patient, or if it's a major sort of safety, a risk to the patient type of issue, you would do that. If they were rude to the patient, I guess if anything that would, I suppose, cause an embarrassment to be done, you know, where the patient can hear or other people can hear. So I guess think about, if I was being given this feedback, would I be embarrassed if other people could hear? And students really do, if they're given some negative feedback in front of other people. I've had students tell me they just switched off and didn't even listen. So you're wasting, you know, the effort that you put into it, because it's in the wrong location. Whereas if it was in a breakout room or an office or something, no one else was around, you'd actually get the message through. Keep the feedback focused. Make sure also it's something that the learner can control. So don't criticise things that the learner's not able to fix. For example, you might have a student who's really, really petite, really short, and they have difficulty reaching to palpate the patient's abdomen, say. Don't criticise the fact that they're leaning on the bed to try and do this, because it's actually as a result of their height, not their particular technique. So try and come up with a way to troubleshoot that by, you know, getting something that they can stand on, so in order for them to be able to do it more effectively. Another important thing is finish with a plan for next time. So you've given them some feedback about something you want them to pay attention to or to change. Send them away and say, okay, I want you to try this for the, you know, the next few clinics, and then make sure when you see that student again, follow up and find out, ask them how they're going. So there are some general steps. The feedback to avoid on the other side is basically the opposite of everything that's effective. Remember, we're wanting to give them feedback, one, so that they change their behaviour, but two, so they actually learn something from it. It's not just telling them, you know, what they're doing right or doing wrong, but telling them information so that they can use it. Effective feedback also can be for things that people are doing well, because sometimes students aren't aware that their communication style is very appropriate. You know, they've got a good communication style, they've got a good manner with the patients. I think very often we focus on the things they're doing incorrectly, and as students, they're doing lots of things incorrectly because they're still learning. But make sure you do try and point out the things they are doing well, because you want them to keep doing that. So here are some feedback types. These are what's known as the sandwich model, and it's basically telling them something good that they did, something that's poor that needs fixing up, something that's good after that. These are just different versions of them. The problem with the feedback sandwich model is the last thing they hear is something positive, and so they often forget the bit in the middle that you're wanting them to work on or to improve. And they just think about, oh yes, he said my communication was good. And that's what they take away from the feedback session. So a more effective feedback model is what's called Pendleton's rules. And again, Pendleton's rules is very much student focused. So the student speaks first, rather than you telling the student everything that they're doing well or not doing well. You ask the student, so how do you think you went? What did you do well? And so the student gives you the answers. And what areas do you think need improvement? You know, what do you think you need to work on? Students are usually quite perceptive and will know that. And I think it allows you to see what they think they're doing well and what they're not doing well. So after the student has said what they're doing well and what they need to work on, you then say, tell them what they did well or what was correct, again, between 1 and 3 points. If they did heaps of things that were correct, just pick the really important ones that you want them to remember, but just 1 to 3 points. And then the last thing is to tell the student the areas that were not correct or the things they need to work on or do differently. Can you see how this model, the last thing you're talking about is what you want them to work on or do differently or change the next time they're with a patient, rather than the sandwich model, which finishes with something positive. So they actually forget about what it is they're meant to be improving. So here are some examples of feedback that you might give to a patient. You did not appear interested in the patient's case presentation. Make sure you acknowledge the patient's communication, non-verbal skills, as well as the purely medical or dental issues. Which one of these do you think is the more effective feedback from a learning point of view for a student? I hope most of you might have said number 2, because it's actually giving the students some information and telling them what they did, where it was wrong. These are actually 2 pieces of feedback for the same topic. So for the first one, you did not appear interested in the patient's case presentation. Well, it doesn't actually tell them how they weren't interested. It doesn't tell them that their non-verbal skills were not being used appropriately. Here's another 2 pieces of feedback that you might give to a student. So it's the same type of feedback. So the first one, the students cannot understand your accent. And if you speak more slowly, the patients will be able to understand you more easily. Which one is the most effective feedback from a learning point of view? Number 1 or number 2? I would suggest it's number 2, because number 1, if it's about their accent or their height or their physical features, they can't change that. They are who they are. Whereas feedback number 2 is actually giving them a strategy for how they might fix up the problems with their accent. So again, try and give the students some information that they can use going forward. And last one is, you did well to explain and demonstrate how to review a social lifestyle and risk factors in that history. That was a good history. Now the second one, that was a good history. Okay, you might say that, but the first one is actually far better feedback, because it's telling the student or reminding the student what they spoke about in the history. And again, it's just reinforcing their learning. If you just say that was a good history, the student might be thinking, oh, well, I had good communication skills, or I was polite or professional with the patient. They may not be clear on what the factors were that they actually were included in what they did. You've also got 2 different types of feedback in terms of being low support or high support, and this means can they learn from it. So here's an example. All right, so the supervisor is saying, well, you could have done that better. Why didn't you focus on getting to the crux of the issue with the patient? Now that might be true, and that's low support feedback, telling them what was wrong. However, if you have a look at the high support feedback, this is much better from a learning opportunity. So again, it's providing feedback for exactly the same topic. And so the supervisor has said, well done, you picked up on the patient's anxiety and reflected it back. But do you think you got to the crux of the issue? So it's far more approachable from the point of view of the student learning from it, rather than just feeling they're being criticised. A couple of things now that I'd like to show you that I think are really handy for eliciting feedback and giving feedback to students is to have a set of feedback cards, or a piece of paper that's printed out, and you ask the student to. There are two types: one's for the student, one's for the supervisor. But this one is for the student completes. And in the left-hand column, you've got all sorts of different areas that they're doing. It might have procedural skills, or particular procedural skills they're doing. And the student, when you have a meeting with the student or give feedback, they have to pick out 2 or 3 that they want to talk about. It makes it a lot easier for you, because they're coming to you with the areas that they're not particularly good at, or would like some feedback on, or need some help with. So it's quite time saving from your point of view. Also, when you've got something written on a piece of paper, it makes it a lot easier to talk about from the student perspective. They've got something to read, and it's likely to be a more effective conversation than just having words. You might also have feedback cards that you have for the student. And again, the topics in the left-hand column, you can put any topics in there that you want. So you might have respiratory system, or medications, or tests, any could be content, or it could be general areas such as professionalism and communication. In the right-hand column is the action plan. You write down what it is you want the student to focus on, for the coming week, or in the next clinic, or whatever. Again, it's feedback that's helping the student focus on what it is they're weak at. And because it's on a piece of paper, one, they'll remember it. And the second one is it's a lot easier to sort of manage when it's on a piece of paper, because it's a piece of paper that's telling them what to do, not you. All right, so that's feedback. Any questions on feedback before we just go on to the last little bit? Questions?
No questions.
Okay, now the last thing I want to talk about is failing to fail, because I think that's one of the things that's really difficult. We're trying to promote the next generation coming through into our discipline, and we want to do the best we can to help them to pass and to qualify and graduate. But failing to fail is a really important issue, and many supervisors are reluctant to fail the student because they think that it's going to finish their career. However, if the student is doing something that is unprofessional, or it is a patient safety issue, one poor report about it isn't going to fail them. However, if they get a number of these sort of reports from different supervisors, it says to the college and the teachers there, well, hang on, we need to do something, or this student needs some remediation or some extra help. So don't see failing to fail as punitive, but more as it's beneficial and helps the student. A model that you might want to use, again, in education, we use lots of models and theories just to help us think about where students are at, or what we need to do with students. So one of the models I really like is the Dreyfus model. And the Dreyfus brothers were psychologists in the United States working for the Defense Department back in the late 1970s, early 80s, I think. And they were tasked with, the US government wanted to have some method of identifying whether their jet pilots were safe to fly. The only way they had was if they flew and were able to land safely, they could fly it. If they flew the plane and it crashed, they couldn't fly it, and they wanted some more steps in between. So they came up with this model, and I think it fits really nicely for all students learning in the health area in terms of what they need. So think about where the student you're supervising is in terms of this model. So if they're a novice, they need recipes. They need exact rules and steps. So they'll follow the approach for taking a history a focused history that's in the textbook. Whereas as they become more proficient, they're able to actually, tweak it to suit the patient and do it more quickly. So thinking about where your student is. So if you've got a student who's in their final year in dentistry and they're still, wanting actual steps on how to do a basic task such as a filling or a restoration or something, that tells you, that student is not up to scratch yet. However, a first year student or a second year student wouldn't be at the proficient or the expert level. So think about what level of training the student is at and where they are. Here's a map or a figure, of the different things, what you can do at the different levels. And this actually helps you, if you can figure out where your learner is, you can actually move them up this scale with different activities and tasks that they're doing. All right, and the final model I want to talk about is the Kruger-Dunning model. And this is the one that, fits into the failing to fail, and it's an important one. So a student's behaviour could be unconscious or conscious, and it could be incompetent or competent. So if you look at the student, if you think about yourself as an experienced practitioner, you are unconsciously competent, all right? You're skilled, you do things without sort of having to think through all of the steps, and you can do it. You might have a learner who's consciously competent. So they're actively working at the skill, paying attention to what they have to do and learning how to do it. They know what they can do, and they know what they can't do. However, you might have a student who is unconsciously incompetent. And this is the dangerous student. This is a student who doesn't know what they don't know, who doesn't know that they can't do the skill, or the student who thinks that they are better at something than they really are. And this is the student who is dangerous from the point of view of patient safety. So what you need to do is think about, okay, whereabouts on this grid is the patient I'm supervising? Are they unconsciously incompetent? And they're the students you need to fail if they're not able to perform adequately. Someone who's consciously incompetent, they can't do a skill, so you don't get them to do it, but they're aware they can't do it. They're not dangerous from the point of view of patient safety. So I just find it really useful to use these models to help think about, okay, where is the student and how do I move them to the next stage, or what do I need to do? But if I could emphasise, don't be afraid to fail a student. It's not going to be the end of their career, especially if they're in that, if they're unconsciously incompetent. Yeah, Clara.
There's a question. Is this the same as insight?
Yes, it would be. Yep. All right. So remember, in all of the teaching that you do, your time is valuable, and we really appreciate you working with the students, but you can't cover everything in every teaching opportunity. So use the essential useful bonus in picking out what it is you're going to teach. So tonight we've had a look at the 1 minute preceptor, and I'd like to suggest it's an effective way to teach, ask questions and give feedback in a really timely manner. We've looked at different types of questions, and high cognitive level questions are better for learning. When you're giving feedback, keep it objective, focused, balanced, timely, and don't forget to follow up at a later date with the student. And don't be afraid to fail a student who is performing badly or compromising patient safety. Thank you. And any questions?
Thank you, Louise. We don't have any questions yet, but I imagine there may be a few participants typing questions. Sorry, can just see a raised hand from Katrina. Katrina, did you want to type your question?
We've covered a lot of topics tonight. If you take one thing away that you try the next time you have students, that would be great. So don't feel you've got to go away and implement all of these approaches.
So we have a question, sorry. A few of the participants were wondering if they may obtain a copy of the slides.
Yeah, if we can do that, we can arrange that.
Okay, thank you. And another question, is there a role for empathy in feedback?
Yes, I think so. I actually think feedback, are they talking about from the supervisor being empathic?
I suppose so.
Yeah, yes, I think what you're wanting to do with feedback is to get the student to open up and be honest with you. So if you're showing empathy for them, that really is encouraging them to say, I'm really scared about having to examine a patient with dementia, or, you know, it gets them to say things they might otherwise not say. However, if you're sort of a little dismissive and perhaps sort of harsh with the student, they're not going to ask those questions, and therefore they're not going to learn from what it is they really do need to know.
Thank you. So if we are encountering the questions, I don't know the answer, what is the best way to say, I don't know?
That's a really good question. You go away and look it up and come back and tell me. It's a great opportunity if they do ask a question to get them and go and find the answer for you, and you both learn. I think as experienced supervisors and clinicians, sometimes we think we have to know the answers all the time, but it actually is really quite enlightening for the students to see, okay, there's not a problem with going away and looking something up and we both learn it. It's actually role modelling a really good practice, because that's what we want them to do into the future after they've graduated anyway. We don't want them to graduate thinking, I know everything, I don't need to go and look something up. But when you've got a student, great opportunity to get them to look things up for you, and then they come back and tell you about it. It's a learning opportunity for them then, and a bonus for you because you get some extra information and learn something as well.
I think that's great, because I think it just also reinforces that we're entering careers, or we are in careers that involve lifelong learning,
Yes.
and we'll have something that we don't know, and so it's okay to say that we don't know.
Yes, perfectly okay. So
a few comments. So just thank you. The Kruger-Dunning model will be really a useful framework to use. Another comment, normalizing a situation would show empathy and get them to build trust in you.
yeah.
And thank you for a wonderful lecture. And I really like the 5-second pause. Well, thank you very much, Louise, again for a very valuable session. I think all of the models and theories, frameworks, and techniques that you've reviewed will definitely be very beneficial for all of us. I know that I've been guilty of failing to fail students, and to provide meaningful feedback. I think the 1 Minute Preceptor will be a very useful tool. So I'm sure we've all learned a lot. So thank you very much. And thank you all for attending. Apologies again for the difficulties. We'll make sure that it's not going to be an issue in the future. And we hope you enjoy the rest of your evening. So thank you very much.
Thank you.